PADnet Tip, PVR waveforms. Part 1. Capturing the waveforms. To capture a good waveform, allow the PVR segment of the PADnet test to run until you notice a steady pattern in the waveforms. The goal is to capture at least 2 to 3 identical waveforms within the graph. It is okay to scroll back and forth once you've stopped the test in order to fit the waveforms properly on the graph. Part 2. When to redo a segment. An example of a PVR that was captured too early can be found on this slide. Notice that no steady pattern has formed and the waveforms appear jagged. This does not qualify as a diagnostic waveform and requires a retest of the segment. Slight movement, including talking, can also affect the PADnet test. On this slide is an example of how movement appears in the PVR waveform and also requires a retest of the segment. Wearing clothes that cover the arms or legs beneath the cuffs can dampen the results of the PADnet study. On this slide is an example of the study performed of the patient with pants on. Since the cuffs are meant to be placed directly on the skin, except when the patient has an open ulcer, wearing clothing beneath the cuffs can diminish the waveforms and suggest a false positive.